Good day everyone and welcome to our reporting entitled Euthanasia on GEC 8 Ethics. The members of this report are Christian Jasam Agag, Jhon L. Valencia, and Ray Anjoy L. Valencia. To be submitted to Sir Joel Jangad, our GEC 8 Ethics Advisor. This presentation is created by Christian Jasam Agag and Ray Anjoy Valencia and to be reported by yours truly, Jhon L. Valencia. So let's proceed on our report. So our report entitled Euthanasia. So this is the outline of our report. First is the introduction of our topic, the history, laws, religion, cases, and conclusion. So let us proceed to introduction. Euthanasia comes from the Greek words eu, which means good, and thanatosis, which means death. It means good death, gentle and easy death. This word has come to be used for mercy killing. It is the act or practice of ending a life of a person either by a lethal injection or suspension of medical treatment. The word euthanasia was first used in medical context by Francis Bacon in 17th century to refer to an easy, painless, happy death during which it was a physician's responsibility to alleviate the physical sufferings of the body. So there are six types of euthanasia. First, we have the passive, the active, voluntary, involuntary, assisted, and lastly, indirect. So we will tackle first the active euthanasia. So the active euthanasia, it is when death is brought by an act, for example, taking a high dose of drugs, or to end a person's life by the use of drugs, either by oneself or by the aid of a physician. Second one, we have the passive euthanasia. Passive euthanasia is when death is brought by an omission. Example, when someone lets the person die. This can be done by withdrawing or withholding a treatment. Withdrawing a treatment, for example, switching off a machine that keeps the person alive, and withholding treatment. This example is not carrying out a surgery that will extend life of the patient for a short time. Third, we have the voluntary euthanasia is committed with the willing or autonomous cooperation of the subject. This means that the subject is free from direct or indirect pressure from others. Fourth, we have the non-voluntary euthanasia. It occurs when the patient is unconscious or unable to make a meaningful choice between living and dying, and an appropriate person takes that decision for him or her. This is usually called murder, but it is possible to imagine cases where the killing would count as a favor for the patient. And we also have indirect euthanasia. This means providing treatments mainly to reduce pain that has a side effect of shortening the patient's life. Since the primary intent wasn't to kill, it is morally accepted by some people. So we have the assisted suicide. This usually refers to cases where the person who are going to die need help to kill themselves and ask for it. It may be something as simple as getting drugs for the person and putting those drugs within their reach. So we will be proceeding to the history of the euthanasia. It is believed that euthanasia started in ancient Greece and Rome around the 5th century BC. Some did this by abortion and every now and then performed a mercy killing even though doctors were supposed to follow the Hippocratic Oath. I will give no deadly medicine to anyone if asked nor suggest any counsel. Or, during the Middle Ages, euthanasia was pretty much out of the question. If one committed suicide, the law in the Europe was for the body to be dragged through the streets or nailed to a barrel and left to drift down river. During the 17th and 18th century, euthanasia was a topic of discussion. However, people continued to reject euthanasia and assisted suicide. During the year between 1478 and 1535, Sir Thomas More is often quoted as being the first prominent Christian to recommend euthanasia in his book Utopia, where the utopian priest encouraged euthanasia when a patient was terminally ill and suffering pain. In 1828, the first law against assisted killing known as anti-euthanasia was passed in New York. In the year 1870, the use of morphine and analgesic medications for assisting quick and painless death was suggested. In the year 1885, the American Medical Association strongly denied the use of analgesic for euthanasia. And in the year 1994, Netherlands is the first country where euthanasia has been allowed. In the year 2001, the euthanasia law was adopted in Belgium. This law defines conditions for doctors to avoid penal punishment. On the year 2008, U.S. state of Washington legalizes assisted suicide. So, we'll be proceeding in the laws of euthanasia. First, in Europe, euthanasia is only legal in the Netherlands and Belgium, provided certain conditions are met. For example, the patient's request must be voluntary and well considered. The patient must be suffering unbearable physical or mental suffering with no prospects of relief. The patient must be informed about their situation and prospects. At least one other independent doctor must be consulted. In Belgium, euthanasia is only allowed if the patient is an adult. However, in Netherlands, euthanasia is allowed for children aged between 12 and 16 years of age, with the consent of their parents or guardian, and for individuals aged 16 years and over. Assisted suicide is legal in the Netherlands, Switzerland, and the state of Oregon in the US, but have certain conditions, like for example, the patient must be considered competent and aware of their situation. In Japan, only passive euthanasia is permitted for patients who have been in coma for more than 3 months, while in Egypt or in Islamic countries, in general, the popular Egyptian scholar Sikh recently issued a fatwa equating euthanasia with murder but allowing withholding of treatment that is deemed useless. So we'll be proceeding the religions related to euthanasia. Those in favor of euthanasia argued that a civilized society should allow people to die in dignity and without pain. They add that as suicide is not a crime, euthanasia should not be crime. Most religions disapprove of euthanasia for a number of reasons. 1. God has forbidden it. That says you must not kill. Number 2. Human life is sacred. Number 3. Human beings are being made in God's image. Number 4. God gives people life, so only God has the right to take it away. So, there are religious views on euthanasia. We have the Islam. Muslims are against euthanasia. They believe that all human life is sacred because it is given by Allah, and that Allah chooses how long each person will live. So we have the Imana, or the Islamic Medical Association of America, says that turning off life support for deemed to be in a persistent vegetative state is permissible. This is because they consider all mechanical life support procedures as temporary measures. So we have the Christianity. Christians are mostly against euthanasia. The arguments are usually based on the beliefs that life is given by God, and that human beings are made in God's image. Some churches also emphasize the importance of not interfering with the natural process of death. Life is a gift from God. Christianity requires us to respect every human being. We have the Judaism. Jewish medical ethics have become divided over euthanasia and end-of-life treatment since the 1970s. Generally, Jewish thinkers oppose voluntarily euthanasia, often vigorously, though there is some backing for voluntarily passive euthanasia in limited circumstances. D, we have Shinto. In Japan, where the dominant religion is Shinto, 69% of the religious organizations agree with the act of voluntarily passive euthanasia. In Shinto, the prolongation of life using artificial means is a disgraceful act against life. E, we have the Buddhism. An important value of Buddhism teaching is compassion. Compassion is used by some Buddhists as a justification for euthanasia because the person suffering is relieved of pain. However, it is still immoral to embark on any course of action whose aim is to destroy human life, irrespective of the quality of the individual's motive. So we'll be proceeding the cases about euthanasia. Number 1 is Gloria Taylor in the year 1948. And ends, or she dies, October 4, 2012. Taylor was a postal worker, residential care worker, motorbike enthusiast, and health advocate. She was born and raised in Castlegar, British Columbia, Canada. Taylor began experiencing the early symptoms of amyotrophic lateral sclerosis, or ALS, also known as Lou Gehrig's disease, in 2003. A neurologist diagnosed her with the disease in 2009. On June 29, 2011, Gloria filed an application with the Supreme Court of British Columbia to be added as a plaintiff in the BC Civil Liberties Association, or BCCLA, Death with Dignity lawsuit. The BCCLA had filed the lawsuit in April 2011 to challenge the laws that makes it a criminal offense to assist seriously incurably ill individuals to die with dignity. The legal challenge seeks to allow seriously and incurably ill, mentally incompetent adults the right to receive medical assistance to hasten death under certain specific safeguards. Gloria Taylor told reporters in Vancouver she doesn't want to die, but she also doesn't want to die an agonizing and horrible death. She also says she's fighting so that all the people of Canada will have the choice in the way they want to die. Taylor had won a constitutional exemption at a lower court for a medically assisted death in 2012, but that decision was overturned in subsequent appeals. On October 4, 2012, Taylor died as a result of severe infection resulting from a perforated colon. Due to the acute nature and brief course of her illness from the infection, Taylor did not need to seek the assistance of a physician to end her life. In the end, Gloria's death was quick and peaceful. Taylor died in a hospital with her mother and a close friend by her side. The BC Civil Liberties Association will be continuing with the Death with Dignity lawsuit, fighting to protect Taylor's victory against government appeals. Number 2, we have Craig Ewert. Craig Ewert was a retired college professor who was diagnosed with motor neuron disease, or MND, a neurodegenerative kind that affects the nervous system and could lead to a difficulty in gripping, walking, swallowing, and speaking and breathing. He decided to end his life rather than spend the rest of his life in a living tomb. Since euthanasia is still illegal in Britain, he traveled to Switzerland to die assisted by the Dignitas Clinic in Zurich in September 2006. He was already 5 months paralyzed prior to his televised death. His last moments was shown in the Sky Real Lives channel live. He first said goodbye to his wife, drank the poison, asked for an apple juice, and requested for a Beethoven's Symphony No. 9, said thank you, and died peacefully. Number 3, we have Frank van den Bleeken. Frank van den Bleeken was a Belgian convicted of a serial murder and rape who has been imprisoned for almost 3 decades. He was temporarily released and convicted other brutal convictions. He sought the right to die because he was suffering unbearably from his psychiatric condition. Unable to control his urge, the convict had no prospect of living in freedom. He has clearly said that he didn't want to leave prison because he didn't want to risk creating further victims. He said, seeing himself as a danger to society, he could no longer live like that, this his lawyer said. After doctors agreed that his psychological conditions is incurable, Belgium's justice minister approved his transfer to a hospital where doctors will end his life on January 11, 2015. But on January 6, the justice minister announced that Van den Bleeken's right to die was withdrawn by his doctors. He was instead transferred to a psychiatric prison ward. So next we'll proceed on the conclusion of our topic. So in summary of the presentation, the definition of euthanasia. It is the practice of intentionally ending a life in order to relieve pain and suffering. The rules of euthanasia. It's not possible to regulate euthanasia. So in religion we have the Islam, Christianity, Judaism, Shinto, and Buddhism, where they mostly against euthanasia. So euthanasia in Egypt is forbidden on humans but applied on street dogs. Vote. What is your opinion about euthanasia? And do you have any questions related to the presentation? So that would be the presentation of our topic entitled euthanasia. If you have any questions, you can raise your hand. If not, that would be the topic of our report entitled euthanasia. That's all. Thank you.